Well, a day after BJP President Nitin Gadkari was operated upon for the treatment of his diabetes, this problem that he's been battling for years, we can now go across to his doctor, the doctor who operated upon him for this gastric bypass surgery or bariatric surgery as it's known. Dr. Lakdawala is joining us from Mumbai. Thanks very much, Dr. Lakdawala, for speaking to us. Up first, how's Mr. Gadkari doing and how exactly does this surgery work?
Natasha, this procedure was a laparoscopic gastric bypass surgery wherein we made 5 or 6 tiny little punctures, and with the help of a laparoscope we've gone and basically made a small little pouch of the stomach and joined intestine to it, so thereby bypassing 90% of his stomach, the duodenum, which is the first part of the intestine, and a part of the small intestine. This surgery was basically done because Mr. Gadkari, despite best medical management that was currently available and seeing his lifestyle, just could not maintain good levels of sugars. He was on insulin for quite some time and he unfortunately just could not manage to maintain his sugars. So they were going high. We had early changes in his kidney because of diabetes, and therein we gave him an option of surgery.
Right.
And now
and
this
he's
is
taken it,
a known form of treatment for an overweight diabetic patient who's not getting controlled his sugars despite best medical management.
Right.
But doctor, what are the chances of this surgery working and controlling diabetes?
It works in 95% of the patients, and as we've seen with Mr. Gadkari, within the last 2 days he's already off insulin. He no longer needs insulin. When he came into us, he was drowsy. He was taking many units of insulin, and despite that his sugars were 300 and 400. Now, just soon after surgery, it's around the 3rd day, and he already needs no insulin and his sugars are normal.
Right, that's of course good to hear the big reason why he was going in for the surgery in the first place. But there are lots of people, of course, nowadays talking about doing this for purely cosmetic reasons as well, aren't they, Dr. Lakdawala?
Yes, actually the reason is when Mr. Gadkari consulted me some time back, he was very clear that he wanted this done for his diabetes and so that he could serve the people better, because his sugars were not allowing him to do so and his lifestyle was very hectic. And that's when we discussed this option, and I told him that this was one of the good options, and if the surgery worked as it has done in his case, he would get fantastic control of his sugars and probably get rid of his diabetes for the rest of his life.
Right, Dr. Lakdawala, thanks very much for joining us, and of course we do wish Nitin Gadkari a very speedy recovery. Dr. Lakdawala, thanks for joining us with all those details from Mumbai this evening.
Well, that's it then from Natasha and I.
Left, Right, Centre is up next.